Hello, everyone. I am Kaitlyn Ryan, Doctor of Physical Therapy with PhysioEd.com. Thank you for joining me today for our question and answer webcast that we're going to be doing here about once a week. So thank you guys who have submitted your questions. We really do appreciate it. I'm going to go through some of them today, but there are some more on the list that we'll make sure that we address later on. These questions are being submitted through our PhysioEd.com on Physio Ed Connect. So if you're watching this and you have questions that you want us to answer, please check us out at PhysioEd.com. Join us on Physio Ed Connect for free. Then you can submit your questions. There's a whole bunch of other resources on there as well, including articles, other videos and webcasts. It's a pretty great thing that we're getting started here to really focus on preventative therapies and really focus on staying active and healthy for a lifetime. So thank you guys very much for joining me today. And we'll just kind of jump right into the featured question for today. So we had someone named Michael, who is 67, submit that he has been hearing that weight-bearing exercises are really good for bone health. So he was wondering exactly what that means. What counts as weight-bearing exercises that is going to really help to improve his weight bearing and his bone health. And what's safe that you could be doing with that? Because there's sometimes where, there's a lot of activities that can be weight bearing, but maybe it's not safe for everybody. So I am going to be giving some suggestions. Now, this is not an individualized program. Just as a disclaimer, it's my recommendations with my experience, not to say that this is an individualized thing that is going to be working for everyone. So if something is not working for you, or you feel it's unsafe or it's causing any pain, absolutely should not be doing any of these things. So please just take that as a disclaimer for today, okay? All right, so once again, we're going to be going over bone health and weight-bearing exercises and things that you can do to get you started. Now, there is a great article on our website, PhysioEd.com, called Building Bone Density Naturally with Weight-Bearing Exercises. And we're going to be putting a link on this video, or a link in the comment section for this video, and you guys can go and read through that. It's very thorough, tons of excellent videos for the exercises we're going to be talking about today as well. So I highly recommend checking that out there too, even when you're done watching this video. So the big thing for the weight bearing and why that's considered to be good for your bone health is that the weight bearing helps our bones build, and it helps it create that density and those things that can help prevent, osteoporosis or osteopenia. So the whole point of trying to weight bear is to keep a healthy bone and keeping a strong bone. So those strong bones really help with preventing fractures. So if you were to have a fall at some point, you don't have a brittle bone, and that bone can really withstand, a force. So that's kind of the main thing for these weight-bearing exercises. It's to keep a bone nice and healthy. It's to keep it nice and strong. And we could go into a whole thing about it, but I'll just kind of keep it simple with that. I think the article does go in more depth about the importance of that as well. So a couple of really simple exercises that you can be doing for weight bearing. I guess I should back up. So weight bearing is basically your body working against gravity or resistance. So that could be weightlifting, that could be, band resistance training, that can be going on walks. Those are the types of things. So things like being on a bike, those are considered lower resistance, less, well, I shouldn't say necessarily resistance, but lower weight bearing activities. They don't load your bones quite as well. Being in a pool, that unloads the weight bearing as well. So being in the pool is not something that we're talking about. We want to be against gravity if safely possible. Now, for these exercises, I'm not sure about for Michael's condition, if he is, wheelchair bound or not. So these exercises are going to be focused primarily for people who are ambulatory. Now, if that doesn't apply to you, please reach out and we can certainly come up with some other exercises for you as well. Give you some different ideas. Just kind of things to work on there. So anyways, with the weight-bearing activities, a nice, simple, easy one going against gravity is just walking. So every time your heel is hitting that ground, that is loading through the bone, and it's that pounding force is creating that weight bearing through there. Now, you can increase that weight bearing by doing things like going upstairs, because you're going to be working against a little bit of extra resistance. Or if you were to do something called a heel drop, and we'll show a video of that exercise. Basically, you just go up onto your toes and then you drop down onto your heels forcefully. And that creates a higher pound and a higher resistance that kind of multiplies that weight-bearing activity. So that little extra drop, that little extra force through your bones helps your bones to kind of build and strengthen themselves. So a heel drop is a great place to start holding on to, maybe a counter or kitchen sink, something like that. You want to be dropping typically onto a firmer surface, not something that's nice and squishy, typically, a tile floor or a wood floor, something like that. That would be the recommendation of the surface to be on for that kind of exercise. Another simple one that could be done in addition to the walking, in addition to the stairs, in addition to those heel drops, something like a little squat could also be really beneficial because it's going to be applying forces and resistances. Even your muscles can apply a little bit of resistance there. So that is a good weight-bearing, simple exercise to be doing. Now, if you have knee joints, or hip pains, any back or osteoporosis problems, you really want to make sure you're maintaining a good posture. So we'll be putting in a video here as well, just showing the squat in the good form. It's all about maintaining, your chest up, sitting your bottom back to offload some of those joints that can be a little bit painful if you do a squat incorrectly. But that's another great exercise that you guys can be doing to load those bones and increase the strength for your bones. And then there is another, technique in addition is just doing weight exercises. So weight resistance, lifting with dumbbells or barbells. Obviously, if you haven't done that in a while, starting with lower weights is going to be the way to go. Going against gravity, you're pushing extra weight up through into the air. Those are things that can be really good. So something simple like a simple shoulder press with a couple of dumbbells, or even, a biceps curl. Those are things that can help load your upper extremities. Most of the ones that we were talking about before were, they seem like a lower extremity exercise, but everything that happens to your legs, that force really gets transferred up through your body and up through your spine. So just because your heel is the one that's hitting, those forces really translate all up throughout the spine. So those exercises aren't just for the lower extremity, they are built for kind of the whole body through there, but maybe a little bit of extra for the arms would be a good thing too, with those weight resistance exercises. So in general, weight-bearing exercises, they're important for a healthy bone because they help the bone build strength and a nice thick bone that can help prevent fractures. So those are important things to do, like walking, the stairs, a heel drop, the squats, or a simple weight resistance exercise. Those might be some really good places to start. Now, again, if any of these are causing pain or problems, please don't do them, and you can seek the guidance of a physical therapist local to you. Now, there were a couple of other questions, and there was one that was, I think, important and kind of related to the bone health. So the bone health, that's about keeping a nice, strong bone, and the big thing is preventing a fracture. And a lot of fractures are going to happen due to falls as we are aging and getting older. So with those fractures, a way to prevent a fracture is to prevent a fall, not just strengthening the bones, but it's making sure that you have your balance and you're not having a fall that's going to put you at an increased risk for that fracture. So there was a question for Carol, who is 71, saying that she noticed her balance isn't quite what it used to be, feeling a little unsteady, especially when she's turning in the kitchen. She had noticed that. So she was wondering kind of the safest way to be doing some exercises to work on her balance that aren't going to overdo it. So again, I'm not sure exactly what Carol's capability is, if she has any, pains or anything that's making it difficult. There are tons of things that could be affecting balance. Vision affects our balance. Our vestibular system, our inner ear affects our balance. Sensation affects our balance. So there's lots of different reasons that people could be feeling unsteady. So I'm going to be talking in a very generalistic tone, I guess I'll say, is that there could be a very specific reason why she is having a balance issue, and there may be something very specific to you, or it could just be that, with the natural aging process, our nerves and muscles aren't talking quite as well as they used to. So I'll be kind of focusing on just that kind of aspect of it. A couple of simple balance exercises. The best and safest place, I always recommend patients doing them, at their kitchen counter, or even their kitchen sink, because they can hold on to that kitchen sink if they were to lose their balance. Something like standing with your feet together is a great place to start. That is going to be a good indicator. If you can easily hold standing with your feet touching for 30 seconds without issue, then you can start thinking about progressing. Maybe you have one foot directly in front of the other when you're doing your balance. Now, these are called static balance exercises, which means you're not moving while you're doing these. So if you standing still is really easy for you, maybe these ones are too easy, but they're a great place to start to get an idea of where my balance is and if this is a good challenge for me or not before progressing to a more difficult challenge, such as something like, walking a tightrope where you're walking your heel to your toe, or maybe you're standing in a corner and you're just kind of focusing on simple turns. Now, you stand in the corner because if you are to lose your balance, you've got something to kind of hold your back against. So I would always recommend, or I really always do recommend, the first place to start is standing with your feet together, not moving, and trying to hold that for at least 30 seconds. By doing that, you're going to get a good idea. Is this too much of a challenge? Is this a good challenge? Or do I need to be progressed further? And you could do things like standing one foot in front of the other, or even just standing in place. Always doing it, near a counter or a kitchen sink, so you got something nice and sturdy to hold on to. So those would be something to start with. Now, again, I don't know exactly what's causing Carol's imbalances. There could be multiple different reasons that these exercises won't properly address, but they're a great place to start if it's something very general and very basic that she is working on there. All right. So those are the quick little questions that we had come in for us this round. We will be touching other talking about other questions that'll be coming in, and please submit your questions to us at physioed.com. Check us out there. You can check us out with the Physio Ed Connect. We've got that article that I was talking about before that's going to be linked to this about building better bone density. There is also a weight bearing. It's a 12-week bone strengthening and balance program. So this is actually perfect for you guys who are reaching out, talking about the bone strength problems, talking about the balance problems. So check us out with that. It kind of gives you a nice week by week things that you can be doing to improve both your balance and your bone health, and really working through all of that with you there. It's a little bit more individualized. It's a little bit more specific. So I think that might be a good resource for everyone there too. So thank you guys very much for coming out and watching us today with Physio Ed. Again, I'm Kaitlyn Ryan, Doctor of Physical Therapy, and we'll see you guys next week.